So last September, we held a conference at the London School of Economics with academics and policymakers and other people influencing policy around the world to discuss child stunting. So child stunting occurs when children have poor nutrition or suffer from chronic disease and don't grow as quickly as we would expect, mostly under the age of 5. And so we use the percentage of children who are too short for their age, under the age of 5, as a proxy for their malnutrition. So as part of the conference, we brought people from a wide variety of fields together to try to understand what long-run perspectives, and also thinking more globally about stunting, how that could help us understand how to fight it today. And so there were really kind of three main takeaway lessons from the conference. So I'll talk about each of those in turn. So the first lesson from the conference was that historical perspectives are actually quite interesting and useful in thinking about how stunting has changed over time. So most people would be aware of how stunting has changed in the last, say, 20, 30 years, where we've seen big reductions in the stunting rate from about maybe 40% of children globally to about 23%. And we can also see that if we look at some individual countries as well. So if we take a look at this graph, you can see that stunting has declined considerably in India and in Nigeria and in the Philippines, though still these countries have quite high levels of stunting today. And we've also seen big declines in Peru and many other countries around the world. But it's useful to think about these in a more broader historical perspective. And one of the contributions of researchers at the conference was to provide some data from the early 20th century for Japan and the United States. So if we look first at the United States, we can see that there were stunted children in the United States in the early 20th century. About 17% of children were stunted in 1918. But that was a much lower level than we see in many developing countries today, and partly that's because the US was already very developed by 1918, and adults were quite tall as well. But Japan is another story. In the early 20th century, about over 60% of children were stunted, and we can see that there's not major improvements in this indicator until after World War II. And really it's in the period between about 1948 and 1986 when stunting rates declined the most in Japan, from over 50% to a more normal rate. So that's 4 decades of change that it took to lead to that decline. And during that same period, Japan experienced income growth at 5.8% annually, and also experienced a 20-year increase in life expectancy. So this was a really a period where conditions were improving really rapidly in Japan. And so, we need to be a little, if it took 4 decades to eradicate stunting in Japan under these conditions, we need to be a little bit careful about trying to guess when stunting could be eradicated in the developing world today. The second lesson from the conference is that we really need interdisciplinary approaches in order to design experiments in a way that will work well, in order to measure the impact of certain interventions. And that's because stunting is caused by a whole range of factors. And because those factors are multidimensional, we need to think about the medical, economic, social, and cultural factors at once. And so experimental designs that only consider, an economic mechanism may miss out on, on social factors and cultural factors that really matter to explaining why stunting is either improving or not improving in a certain area. And along with that, we need to be aware of individual variation and spatial variation in stunting, and how that changes over time, and how kind of different policies may affect different individuals or subgroups within populations differently. And all of that can come together from a more interdisciplinary research focus. The third lesson from the conference is about adolescence. So we observe both in historical and modern studies that children who were stunted earlier in their lives can experience some catch-up growth during adolescence. And so we need to do more research to understand whether the catch-up growth that those children experience is, fully comprehensive. And what that means is, does it offset the kind of negative effects of stunting earlier in life? Does it, improve their cognitive abilities? Does it affect their health later in life? And so we really need more research to be able to understand that. So those are some of the main lessons from the conference. If you're interested in learning more, you can find more in the conference report, which is available at the link that's available on the screen. And please feel free to get in touch if you have any comments or ideas.